I'm here to pick up a prescription.
Okay, what's your name?
Jesse Marston.
Hi Jesse, my name is Matthew. I'm the pharmacist on staff here today. How are you doing?
Good, thanks.
Your prescription's ready. Would you have about 5 minutes to go over how to take this medicine, what to look out for, any concerns you have we can address as well?
Sure.
Okay, go ahead and have a seat. And before we get started, I wanted to make sure our profile information is up to date for you. Here's your profile. Is that your correct address and phone number? Date of birth is correct?
Yep, all looks good.
Okay. And what conditions do you have? Do you have asthma, diabetes, anything like that?
No.
Okay. And what are you allergic to? What medicines?
Nothing.
Nothing? Very good. And what are you taking over the counter right now?
Just a daily multivitamin.
Okay, sounds good. So today we have a new prescription for you. Your doctor sent over Ventolin, APhA. That's an albuterol inhaler. So Ventolin's the brand name, albuterol is the generic. And what did your doctor tell you this was going to be for?
Well, he said it would help with the difficulty I've been having breathing while exercising.
Okay, so yeah, many people take this medicine when they get short of breath when they exercise. Is that what happens to you?
Yeah.
Okay, and what do you do for exercise?
Well, I exercise 3 times a week. I'm on teams, and I go to the gym.
So you're pretty athletic, it sounds like.
Yeah, exercise is huge to me.
Okay, so yeah, this medication you're going to be taking for the shortness of breath. How did your doctor tell you you're going to take this?
He actually said he would be going over that with me.
Well, he's right. So this medicine, for people who haven't done it before, there's some technique to it. So we're going to go over that today. I'm going to open the box and show you how to do it.
Okay.
So it comes in an inhaler like this, and there's 2 parts to the inhaler. There's the cartridge, and there's the mouthpiece.
Okay.
When you are about to exercise, about 15 to 30 minutes before you're going to exercise, go ahead and take this out. And for the very first time that you use this, so not every time, but this when you go home this first time, and then you won't have to do it afterwards, you're going to want to shake it real well and prime it 4 times.
Okay.
Just spray it into the air. That gets this ready to be used for the rest of the time.
Okay.
You have to do that for new inhalers from now on. But after you do it once, you're good. So this is going to be put in the mouth. And I'm not going to put it on my mouth because I don't want to spread germs. But you'll put it in your mouth, head down. And at the same time you press down, you'll be breathing in deeply. So hold it for 10 seconds. That's very important. So that way it gets into your lungs and can reduce the shortness of breath.
Okay.
Okay? Does that make sense?
Yeah.
And your doctor said you can use 2 puffs. So after you finish the 10 seconds, just right away you can do the second one. You can give yourself about 30 seconds to a minute to take a break if you need to.
Okay.
Okay, and then you can put the cap back on. And if you forget to take this medicine and you feel like, oh, well, I'm about to exercise, go ahead and take it right away. So as soon as you remember that you forgot to take it before you exercise, go ahead and take the 2 puffs. Okay? It does take a few minutes to work. That's why we said 15 to 30 minutes before exercise.
Okay.
Does that make sense?
Yes.
Okay. So for storage, I want you to keep this in like a cool, dry room temperature area. You can keep the canister in the device. And there's actually a counter right here. There's 200 actuations in here. It says 204 when you first get it. You'll puff 4 times in the air, and then it'll be 200. So you do have 1 refill of this left. Your doctor gave you a refill. And when it gets down to maybe 10 to 20, give us a call. We'll fill it for you.
Okay.
Sound good? And what did your doctor tell you to expect from this medicine?
He just said that it would help with the breathing.
Yeah, so you're very athletic, but you have that shortness of breath, which limits you. This will hopefully cause you to feel better when you exercise, not have shortness of breath. There's a couple things I want to warn you about, though, because when you take this medicine, there are some side effects. You may feel a tremor if you take too much. Your hand might shake a little bit. You may feel your heart racing. That's normal. It may mean you're using too much, though. If you get that often, tell your doctor. And then also, there's a major side effect I want you to know about. You said you don't have asthma, right?
Right.
Okay. Asthmatics sometimes have problems if they take too much, but you're just using it for exercise-induced shortness of breath. But if your breathing gets worse when you take this, definitely stop taking it. See your doctor immediately. Okay. That happens rarely, but sometimes people, they use it to feel better, but they feel worse. Okay. Okay? Just to wrap up, how are you going to take this medicine?
I'm going to take it 15 to 30 minutes before I exercise, inhale deeply as I press it, and then hold it for like 10 seconds, and then do it twice.
Exactly. Do you have any concerns?
No.
Okay. Well, let me put this back in the box for you. There you are.
Thank you.
And our number is on there. Have a good day. If you have any questions, go ahead and give us a call, and I'll be happy to answer them at any time.
Okay.